All right, welcome everybody. We have Trish and Gina giving their presentation. Go ahead, y'all. You can take the floor.
Hi, well, thank you for letting us do this today. It's very exciting and we're very thankful. We are the Housing and Essential Needs HEN program of Catholic Community Services of Kitsap County. This is our staff with our little logo, our HENs. Katie Knudsen is the director of HEN Southwest. Gina Glowen is our program manager. I'm the lead case manager, and we have Heather Levine, JD Cross-Graves, CJ Johnson as outreach case managers, and Tracy Quigley's our administrative assistant. What is the HEN program? The HEN program is a state grant program funded through the Department of Commerce and operated by Catholic Community Services in Kitsap County. The clients we serve are individuals receiving the aged, blind, or disabled cash grant through the Department of Social and Health Services. This is something that's confusing for a lot of people because they don't seem to always understand that we can't just pick someone up. They have to get the referral from DSHS. And the goal of this program is to assist people experiencing homelessness or who are at risk for homelessness, find and maintain safe and stable housing. Any questions? No? Okay. We also provide the Bridge program, which is additional rental assistance services once the client is receiving an income from Social Security. Per CHG guidelines in the Bridge program, the clients will receive an additional amount of time with subsidized rental assistance. The client must pay a percentage of their income towards their rent in this program, and HEN will cover the additional amount. The caseworkers work closely with their clients during this time to find a housing solution that the client can manage without rental assistance. The HEN program strives to never return a client back to homelessness and approaches assistance for each case on an individual basis. The eligibility requirements. Clients are required to check in monthly with the HEN program and to follow the terms of use. Clients who are receiving rental assistance remain eligible as long as they are still eligible through DSHS and HEN guidelines. Per the CHG, while on the ABD program, clients must be actively pursuing federal Social Security income. If you are not eligible for the Age, Blind, or Disabled Cash Assistance Program and you are unable to work for at least 90 days due to a physical and/or mental incapacity, individuals may still receive a referral to HEN. Terms of use. All participants of the CCS programs have rights and responsibilities as follows: to be treated with respect and dignity, confidentiality, safety and security, housing inspections, and per CHG guidelines, clients are expected to participate in program engagement. Client services. We always work to make sure a stability plan has been designed to assist clients with achieving housing and personal goals to maintain a self-sufficient lifestyle. Ongoing case management to ensure that clients are maintaining their eligibility with DSHS for the HEN program and the HEN agreement. And assistance with applying for SSDI, SIA, SSA, and retirement benefits. And contact information for a wide variety of community resources. We also supply essential needs items once a month: bus vouchers, rental assistance, security deposits, move-in costs, toilet paper, toothbrush, shampoo, bus vouchers, and shampoo, just to name a few. The HEN active list and wait list. Active rental assistance caseload, that's clients receiving full rent payments through HEN. Right now, we have 86 clients we're helping. Clients on the priority pool for rental assistance, waiting for assistance. In the rapid rehousing, which is all homeless clients, we have 189 clients. Those that are housed and in jeopardy, 66. And we have 117 on the wait list for the priority pool. There are 31 clients on the bridge priority pool wait list, and those are people receiving Social Security. But on August 1st, 2025, our priority pool wait list was closed due to a lack of funding. All new client intakes are placed on a separate wait list. Additional information is requested. For Clallam and Jefferson counties, Catholic Housing Services. This is the best number to reach out at, and the services offered are substance use disorder treatment, family center services, family behavioral health system, housing, volunteer services, and long-term care services. Thank you for your partnership in serving our county. Okay.
Sorry, I kept clicking my video and not my audio. I don't know why I don't know how to use Zoom yet. What questions are coming up? Does anyone have anything they'd like to ask Gina and Trish?
Um, Hi. I would like to ask, if okay, at the Clallam and Jefferson County, is that separate from the numbers that you were saying with the wait list? Is that a different organization?
Yes, so the Housing Essential Needs Program and is only the information that we provided is KidSAP only. We aren't all connected as we should be, but we have different agencies that work with the HEN program, and the information provided is our agency here in Bremerton.
Diane, I see your hand, and then I'll jump into the chat to get those questions answered.
Do you have suggestions for people who want to get on the waiting list or of how they can get their needs met?
So our program is a referral-based program through DSHS. They have to be disabled, unable to work, and receive that referral through DSHS. And unfortunately, people that are now coming into our office with those referrals are placed on a wait list for our wait list because we just thought it was unfair to people. The numbers look about 200, but honestly, it's closer over 300, close to 400 people that have just been waiting to go to receive ongoing rental assistance. So that was just a decision by our director that we were going to close our wait list again for intakes. So they're on a wait list for a wait list. There's no way that we can move them forward ahead of other people. It's just right now, that's just how our program is. And I'm pretty sure it's in Thurston County as well. They can still receive, go ahead.
Oh, there's just another question. You can keep going.
Sure. Well, they still can receive essential needs, bus voucher, and case management services. Like we can help them get on subsidized housing wait lists and such. Like if they schedule an appointment with us, they aren't denied any of those things. We just can't offer them ongoing rental assistance when we have some people that have been waiting over 4 years for ongoing rental assistance. And I just want to say that it's through coordinated entry. When they do come into our program and they do our intake, they have to fill out it's called a vulnerability assessment tool that is used through our coordinated entry site, which is Housing Solutions Center. So basically they have to check the boxes that fit on our coordinated entry assessment tool in order for them to hit the top. And that means that people who are experiencing substance use disorder in recovery, people who have been in trouble with the law, there's this, it's more catered to people who are experiencing homelessness, but we do make exceptions for people who, say they are experiencing blindness because of diabetes and cannot work. We have made exceptions in the past where they don't have to always fit that coordinated entry vulnerability assessment tool. But more often than not, they go to the top because we send that, we have them fill out that tool and we send it to Housing Solutions Center, and they put our clients on our wait list according to their answers to that assessment tool.
So, Trickettson, before we get to you, there was a question in the chat, so give us just a moment. Elena asked, do we have any resources for Clark County area? They're still kind of new to their role, so trying to find out as much as possible. Do you all know of any resources, or if you have a HEN program in Clark County?
Yes, we do. We have it in all of Southwest, and in Clark County, they're offering family center services, volunteer services, and long-term care right now. But it looks like they have easy access to other services close by.
So we have a telephone.
And I can give you a phone number for that.
And then that leads me to the other question that was in the chat. Can we get a copy of the slide deck? Trish, is that something you're able to forward me once we're done with this and I can get that sent out to folks?
Absolutely.
Fabulous.
Yes, I will do that. For Clark County. Oh, okay.
Yeah, if
A
you
good
want to,
phone number?
yeah, if you want to pop the phone number in the chat, that'll be great. And
Okay.
then, Tina, looks like you've got a question.
Hi. When it comes to the tokens, because I'm actually from KCR, we've been sending people over to you. I know you've told me in the past that they need to come on the last day of the month to get their voucher for the bus for the next month. Can they only come on the last day of the month, or can they come, like, say, through the first week of the new month?
It just depends on when we run out. We have 70, sometimes we have 80, sometimes we have 90, just depending on our funding. So it's first come, first served. We start giving them out the first day of the last day of the month, if that makes sense. And then we provide those bus vouchers until we run out. And we do have some bus tokens available from KCR that we hand out when we run out.
Thank you.
You're welcome.
So we've got another question in the chat. What counts as a physical or mental sorry, I can't read either today. What counts as a physical or mental incapacity for those who are not eligible for ABD cash assistance?
So that is something that we don't really have that answer for because DSHS determines that. So clients go ahead and they apply for cash benefits similar to applying for food stamps, and they have to meet with a social worker at DSHS, and DSHS determines if they are not eligible for the ABD benefits and whether they are eligible for the HEN voucher, or the HEN referral. So honestly, they don't really tell us what those guidelines are. It's unfortunately kind of a mystery to us is how they determine that, but they are the ones who determine that, and then they send us the referrals.
Great questions. It does.
Okay.
So I know that you mentioned that your housing portion is on pause, but folks who are needing support with the other needs, like the essential needs, what does the wait look like for that?
They can come in on a daily basis. It's just a walk-in. Clients are welcome to come into the office from 8 and we close at 4. And if they need essential needs, they are welcome to have essential needs once a month. We have a list of essential needs that we offer them. That bus voucher, again, is at the end of the month until we run out. And then case management services, they can, if someone's not available to meet with them today, if they walk in the door, we schedule an appointment with them.
To get those essential needs, do you have to have a referral from DSHS?
Yes. Yes, to receive any of the services, case management. Sometimes we will help people with case management or, give them referral or give them uh, other options that we have, resources that we have. But for most of the services that we provide, they need that referral. They have to be a client of ours in order to receive the essential needs, especially the bus voucher.
So it sounds like for this program, the first step then would be getting somebody connected to the DSHS program.
Yes.
Is that right?
Yes, they have to go through DSHS. They have to get the HEN referral. They have to apply for those cash benefits. They have to be unable to work full time. And oftentimes, if they can work part time, they'll be denied. That's just what I've seen as their criteria. But yes, they need that referral from DSHS, and it takes a while for them to get it. They don't just hand them out, but we do receive several referrals a week.
Thank you.
And then to clarify, when you say get enrolled with DSHS, like, do you recommend that they go down to their local DSHS office? Is there like an online form that you recommend them completing? Like, what is if, as you know, the folks that are on this call, they're care coordinators. So like what would be like the best approach for them to support someone getting connected to DSHS for that?
So online, it's washingtonconnection.org is the website that they go to, washingtonconnection.org, and they fill out that application for cash benefits. And then the client follows up, and you can do that either on the phone, but I found out that it's best in person because if they go in person, then they can go ahead and meet with a social worker right then and there and start that process. Because the wait time on the phone can be hours. So, the client can go, you can do that application online, washingtonconnection.org, apply for cash benefits, and then follow up in person would be the best bet. But oftentimes we just send people to DSHS and they can do that application there and they can meet with the social worker there as well.
That's super helpful. I appreciate you shedding a light on that process.
Great.
Any other questions coming up from folks? I only see like 5 faces, so it's hard. What was that?
I'm sorry, I apologize if we don't have a whole lot of information on other counties. It's just our HEN program is specific to Kitsap County. And so again, I apologize that we don't have a whole lot of information on how they're doing or what their availability or offering is right now. It's just we're kind of separate entities.
I just wanted to add too that many times people come in and because there's such a housing shortage and wait in Kitsap County, they want to know if they're eligible to transfer their HEN and their place on the wait list, and they can't. Each county is their own separate wait list and priority pool. And that's really hard, but it's important that people know that.
I was just going to ask that question. If someone living in a different county that was getting the HEN program staff moves to a different county and they still need that support, if that was transferable. So thank you for adding that in.
Well, I will say that we can say if a client has HEN assistance, they're on active rental assistance here, and they want to move to another county, we can pay moving costs to move them over. But oftentimes they will start over at the bottom of the list in another county. They have to go through DSHS. They have to start that whole process over again. And it's unfortunate that that works out that way. And again, it's just county to county. We don't really communicate how other programs might work a little bit differently, but there's really no connection between the counties on how the HEN program works or what their wait list looks like or anything like that.
Awesome. Well, it doesn't look, it's hard for me to view because there's only like 5 faces on the screen. So I'm assuming silence means we're feeling good on questions.
I
I
have
just
one more question.
go for it, Kelsey.
So say someone puts in the referral through DSHS, they go through all the ways that they're supposed to. What do they need to bring with them to their first couple of appointments? Or like what do they need to have to be as prepared as they can to have a really successful first appointment?
So when they walk into our office, they have to have their HEN referral and an ID. Usually it's just an ID, and then that's all we need. Right now, we're not doing intake paperwork. We're not, we'll take a little bit of information, we'll write down their contact information and another, anyone that we can get a hold of in case we can't get a hold of them. But if we were doing intakes, it's still the same thing where it's just a copy of that referral and an ID if they have it. We don't have to have their ID, but it's nice to have an ID to prove it's that person. And then we just get we get the ball rolling. When we're doing intakes, we do the intake paperwork. We send off that information to Housing Solutions Center, and they go ahead and place the client on our wait list for active rental assistance.
Faith put into the chat that she knows that Kirsten Nielsen is in charge of the HEN program for the Clallam County Serenity House. So the folks that are from Clallam County, it looks like Kirsten would be a really good contact for that piece. Tina, I see your hand.
Yes. Is there an expiration date to the DSHS referral?
1 year from the referral. Actually, 6 months. Yeah, so we need our referrals to be 6 months.
It isn't exactly for
Right.
DSHS and services, but they are required by DSHS to go in at least every 6 months to update their eligibility to make sure that nothing's changed. And they send us a new referral. And when people are on the HEN program, there isn't, as long as they stay qualifying with DSHS and they're talking to us and we know what's going on, there isn't a deadline for their services.
Maybe I'm getting this wrong. We've always been told that the actual physical paper referral from DSHS to take to you guys is the referral, that you aren't sent anything from DSHS. So if they lose the paper referral, they have to go back into DSHS and get it. Is this correct?
Well, we have someone who no longer works here that was going to DSHS every Wednesday. And so we plan on having that position again once we start taking active referrals. But so yes and no. So no, because we are able to get referrals, like we get a binder. We have a binder full in our office that has the referral. So if they come into our office, oftentimes we'll have that referral in that binder. We just haven't, we haven't had that position filled in about a month, and so we haven't received any referrals lately. So,
but if someone comes in and they knows they got a phone call, for the referral, we are able to verify it through the benefit verification system, and we will go ahead and get them started until we can get the actual copy.
So the referral is under BVD, BVP?
BVS.
BVS.
Yeah.
Okay.
Yeah, through DSHS. We can check to see if they're active in the system.
Yes.
But we're really not supposed to, when we're doing intakes and when we're sending it off to coordinate entry, we do need that referral before we send it off. So if we don't have it in our binder, we haven't received it from whoever is going into DSHS on a weekly basis, then we do ask, yes, that they have to go back to DSHS. It's a hurdle for them to go do that, but yes, they have to bring that referral in before we send it off to Housing Solutions Center, KCR.
Right, because we are, as I said, I am from KCR, and we have people coming in who are usually high on the substance abuse or high on the mental disability register that are showing up with a referral that they found in the bottom of their backpack from 6 months ago, thinking that that's all they had to do in order to be on HEN. And it's just the referral. And we end up going, I'm so sorry, this is a referral. You need to actually go and follow these directions to Catholic Community Services in order to register for HEN. And at that point, they're just, why bother? So that's what I'm asking about as far as the expiration of a referral. If they haven't even turned it into you, is it still good for a year?
My understanding is that it's 6 months.
Okay.
That if it's older than 6 months, then they have to go get a new referral.
Okay, thank you.
Tina, you bring up a good point though, because many times people will call or come in and say, well, DSHS said we've got it. Why do we need to do anything? Because that's the way the grant insists that it's done. They do have to come in and meet with us. We do have to verify who they are. And there is paperwork that needs to be done. So yes, I can understand what you go through.
So before
Yes.
they can go to KCR, they do need to check in with you guys. So they have their referral in hand, they go see you guys, and then they go to KCR for the coordinated entry paperwork.
No, we go ahead and send off that coordinated entry paperwork to KCR once they come into our office.
Okay, so they don't have to physically go there as long as they're going to see you guys.
Correct.
Okay, great.
Diane, I see your hand.
Yeah, when is the next funding cycle?
Oh, that's a great question. We just started, we get a 2-year funding cycle that just started in July. So 2 years from this July, like, if that makes sense. So we received our contract, it started in July and it lasts for 2 years. And it's split into two. And I'm going to be honest, like I just took on this position, this role about 2 months ago. So it's something that I'm still learning about.
Any other questions coming up to the top? Really great questions. I'm so happy that we had you all join the call to get some clarification on some things and shed some light on, I learned something new about the process. So that's, it's always nice to have y'all be able to present. And I know that you're not completely familiar with every single, county, but it is nice that in your presentation you've got some, like at least a phone number to call, and then Faith was able to add the contact for Clallam County, so that's super helpful. I just want to thank y'all for your time. Trish and Gina, you are awesome, and I knew you in my past life, so I'm excited that I get to see you in this role. You're doing amazing work, and I'm really excited that you get to connect with our care coordinators in the community so that they can feel connected to your resource. Like I mentioned, this is being recorded, so sometimes I have tech issues, so typically I can get this up and going in the same day, but every blue moon, YouTube likes to be mean to me. So hopefully this will be up by the end of today on our OCH YouTube channel. And then for folks who are part of the Olympic Connect care coordinator team, this will be in Blackboard with the PowerPoint, hopefully by the end of today. So you'll have access to this recording as well. But just want to thank y'all for your time. If you have any questions, I'm more than happy to give Trish and send y'all Trish and Gina's email so that you can contact them directly. And then, yeah, they'll go ahead and send me the PowerPoint and we'll get this uploaded and sent out to y'all. Thanks for your time, and we'll see you next time.
Thank you so
Thank
much.
you. Bye-bye.